Alrighty. So, it's yet another Friday. These ones, they're going fast. They're really like going very quickly. Um, Given it's halfway through the first month of 2024. Like, what the heck? So, for those who don't really tune in or haven't yet tuned in, because I'm almost next week will be 1 year of me committing to going live every single Friday at a time that I actually do know that most people cannot attend during this time. And I have a reason for that. However, that's not really that important right now. What is important is that it is the beginning of another year, calendar year. And around this time of the year, today's topic of what white coat syndrome is important because it is probably, in my opinion, there's a lot of factors as to why mental health is not talked about, as to why it's not important to people. And I don't necessarily think it's, and I use quotes because it's not that it's not important, but a lot of times it just scares people to a certain extent that they don't even really know it scares them. Because avoidance is not something that a lot of people like to admit that they do. However, thankfully, why this is a vulnerable conversation is because I admit my faults to a T to y'all, that I am a complete sufferer of white coat syndrome, or once was. So I'm here today with my white coat, little therapist joke, because I am not a doctor. I do not have a PhD. I do not have a medical doctorate degree, nor do I want one at this point in my life. And but as a therapist, our coats are our cardigans. So I wore my white cardigan specifically for y'all to talk a little bit about like what white coat syndrome actually is. Let me take these off because my background is like messing with that. And so, yeah, I dive in. So I want to talk a little bit about what it is. And then I also want to give you some tips specifically that counteract a lot of what is happening. So anyone, show of hands to the ether here. Let me pull up this chat so I can keep on. But what is white coat syndrome to you? Have you ever heard of it? If this is a new concept, totally understandable, because I will tell you guys this: white coat syndrome is not a diagnosis. Like, I'm not talking about, truly clinical stuff here right now, but it is a very clinical issue. And clinical just meaning an observation that a lot of people ultimately share the same pattern. But this is not a diagnosis. This is more of kind of like a trendy term. It's more of like a concept in the healthcare field. And what I mean by that is, like, think of it like it's a phenomenon. It's what happens in terms of human behavior. And like groupthink, if you've ever heard of groupthink, is that ultimately when we're in a group, we tend to share the insights or want to gather around one particular thought process or insight, because standing alone is very challenging. It's very intimidating for some people, myself included. Be like, yeah, I'm a people pleaser, recovering people pleaser. And so, but that really is more rooted in what we know as bias. So groupthink is more the true, like, where it comes from is bias. Groupthink is the concept. White coat syndrome is the concept, and it's really rooted a lot in fear. It triggers avoidance, and then we get these situations where we have all these negative things to say about healthcare insurance, why it's not inclusive, why the healthcare crisis and mental health and opioid crisis and diabetes and all these health issues are happening. But it really starts from the individual level as to when we don't understand why we don't actually go to the doctor. So I want to go through just kind of real quick as to what some of the reasons are. I think most people already share your opinion here. Why don't you go to the doctor? I'm going to start with mine. And that was because for a long time, ever since I was a child, I was always told that I was overweight and I need to lose weight. I'm going to kill myself eventually because I have so much weight on me. And I just, guess what? It wasn't working. So I had a very big distrust. And ultimately what started to reinforce is shame around going to the doctor. And what are doctors known for? Wearing white coats. So here we are. White coat syndrome is really just the conditioned aversion, so avoidance of and deterrence of a particular concept, or in this situation, a white piece of clothing that signifies a person, or it doesn't matter what doctor, what physician, you could have the nicest person in the world, but if they're wearing a white coat, we now associate that and we're triggered fear. And it triggers our associations with a particular other doctor. And so this is really something that a lot of people struggle with. I have a lot of my clients who sometimes they don't even like really consider going to the doctor if they have some degree of a disruption in their day-to-day routine, and then I'll start to like, I'm nauseous and I'm vomiting. Some of that I'm not going to say is normal. You're on a normal day, you're not nauseous and vomiting. So if you notice a disruption to your natural pattern where you don't quote unquote feel good, and you don't consider whether or not you should go and consult maybe a physician, there's probably a conditioned response going on in some regard to how you avoid taking care of your health. That is quite reinforced by the consideration to what going to the doctor actually would do. Now, that's just partly of my experience, but there's a lot of, who does this actually affect? And one of the biggest populations I see it affecting is marginalized people, marginalized communities in general. Having a Western medicine culture around healthcare where we have not attributed or provided enough cultural competence to understanding what it's like to be and have no representation of Black, brown, people of color in a healthcare role. There is just a clear inability to relate, honestly, with someone who looks like me. And so that is something that it's very real. Whether you don't understand that personally or not, that's okay. You may or may not be in a healthcare position where that is something that you have to understand. But I am now speaking directly to my social workers, my doctors, nutritionists, dietitians, whatever role you have in healthcare. One of the biggest issues that you're going to face is the inability to relate, and potentially taking it personally if someone does not relate with you. So this is a really huge, this is pretty much the undertone and the root system of our racism discussions today. Discussions is being nice, honestly. But since this is not a discussion about racism, I'm going to go back to white coat syndrome. We can't even get to like some of the root causes and the root issues because of just that one consideration to there's no representation. If I'm talking to a male doctor, and it's not, so take the race construct off of it and put on just a gender construct. I see this a lot of time with male gynecologists get really a bad rap with being stigmatized and stereotyped, which they do, stereotypes do exist for a reason, but for being a male-female related health physician. And because a lot of people and a lot of women, you're not going to a gynecologist if you're a male, but a lot of women aren't able to connect with their physicians. And at some point, and unfortunately, because the sexual assault statistics for women or sexual abuse like experiences are high, they're going to be more averse to going and considering their own health just because of the representation. Now, that's just one variable in how white coat syndrome gets to exist, but it tends to affect people in what is a marginalized population. It's really one that does not have a standard or fair amount of power in the dynamic of where we stand in society. That's just it. I can't change that reality, so I figure out and I work with people to try to help. How do you keep an awareness of that reality, but also challenge that reality as well? Because it's not just all in your head; it's real. Like white coat syndrome is a physiological reaction to potential, just one thing that weeds itself into so many different things. So I'm going to try to do it justice with trying to like pinpoint for you guys. If you do struggle with like knowing that it's the first of the year, the only reason I'm talking about this today is because literally, I don't know if y'all can see this. Hold on. I went and I got my labs done today. I have to get my physical done in a couple of weeks. And I got an email from my primary care provider. And that's the only thing that I really prompted me to be like, oh, maybe I just need to go take a look. Like, what are my levels? And after a certain point in your life, like after the age of 30, I believe is the most recent article I've seen, is that after the age of 30, if you're not getting your blood, your CBC counts done every year to just know your baseline, then I don't really like to promote being behind in life a whole lot, because you're really not, but you could become being behind in terms of knowing your own level. And that in itself is going to cause a mental health issue for pretty much anyone around you and for yourself. And the reason I say that and why is because more than likely you're not taking a look at the impact of what you're drinking. And I don't mean alcohol, I mean specifically just water. And I'm gonna tell you all about something that happened to me today. I guess I'll do it right now. So for the most part, y'all see me in my videos, I carry around this because this is like, if I do not have a water bottle that keeps my water cold, I will forget to drink water. And this earth is over 70% water. We are over 70% water. If you are not drinking enough water in itself, it's going to cause an issue. And so just this week, I have had actually a really busy week, and it continues to roll over. It's going to continue to pick up, right? And, you have to do fasting lab. So meaning you don't eat before you go to your lab. And I apologize if I'm over explaining this for people. I know y'all are intelligent, but I just like to be thorough. So when you go to fasting lab, I have a really solid vein right here in my arm. I got two, the same one on each side. And so phlebotomists have always honestly complimented me on that vein. They're like, oh, that one's easy, because it makes their job easy, right? Well, for the first time in my life, and then given I've been working against my white coat syndrome for the last 5 years of my life, that was a huge consideration to my transformation physically, let alone with my mental health, is that my vein collapsed. I wonder why. And I was like, why is that? Like, was I talking? Was I, rushing there because I was, a couple minutes late? No, it was because she's like, no, it's mostly because of dehydration. So for the people, I learned something. Shout out to this woman who, hopefully, she'll see this, and she shared with me that I was very informative for her when it comes to mental health, is that when you just don't have food that contains more water typically than just drinking water, so then therefore making sure that you eat and having a relationship with food that is healthy and balanced is going to make sure that just your veins, those things that we all that they can produce, my vein collapsed, one of the biggest veins, and I was like, oh, let me go ahead and get back on my water intake right then and there. Well, not exactly in that moment, but it was in the car. I'll do it right now though. So this is your sign. If you're seeing this, drink some water. You don't have to gulp it down. Don't, overcompensate, but just start now. Just set a reminder on your phone to drink water, because that in itself, if you're dehydrated, your brain is not going to be able to overcome the other things I'm about to bring up for y'all to be able to combat white coat syndrome. So we went over, kind of like what it is, who does it really affect? The marginalized populations, we're just going to have a little bit more reactivity to stress and are going to require more intentional regulation. Now, I'm gonna be honest with you. This can plague anyone. Doesn't matter how much money you have or how privileged you are. Okay, it is really just about your individual personal response to how you take care of yourself. But I will say that people who have had and grew up with more financial privilege in this world are less likely to have to deal with this in some way. But that doesn't account for that much, like, really, because I see this, I've had very different types of clientele, plagues just about every one of them. And then also, this is not just for like a primary care physician and getting your blood work done and getting an annual physical. I see this a lot specifically with dentistry as well, that there is a fear of going to the dentist. Not only, and I can completely make sense of it, why, given that I've never struggled with that aspect. But guess what? Dentists are doctors as well, and they also wear white coats. So, in this, honestly, this is probably, I get this in some way, not that I wear a white coat all the time. And this is, although this is my favorite sweater and I do wear it often, but it is something that whenever I just tell someone that I am a mental health therapist, or I don't even put mental health in front of it, I just said, oh, I'm a therapist, I get one of a few various responses. One is like, oh, are you psychoanalyzing me? Is that I now become almost a threat to people just knowing and getting grouped in. There's that groupthink reference again, but getting grouped into this whole world of healthcare, that I am now triggering something internal by just, before I even say, yes, I am psychoanalyzing you, because what that really means is that I'm collecting information about you to understand you. That's all psychoanalyzing means. Now, you have some therapists out here and just people who do this, or psychoanalysts who share information without consent. And that is where we as mental health therapists, in my opinion, have caused a gap from abusing our knowledge, because there is not a respect to the boundary that just because I think it does not mean I need to share it with you. And it doesn't mean that I'm judging you either. But then it doesn't really matter. This is where people's judgment of themselves for having human issues, like having an avoidance of going to get your physical, like we're talking about, it creates shame. And it creates self-blame, and then it creates projection back onto me. It's something I deal with on a day-to-day that I have, at first, when I started in this profession, I didn't know how to handle. I was like, no, I don't want you to pretend, I'm fine. They taught me all about it in school, but dealing with it is a very different phenomenon for a clinician specifically. Now, getting back to the concept of like, this is where you just have to be mindful from an individual level, is what is your relationship like? What has your experience been like with going to the doctor, with your health anxiety? Because that's in itself a whole, we make jokes about being a hypochondriac or being a germaphobe or being like super, that's not a joke. Oh, excuse me. It is a joke, but we both know. We all know at some point jokes have a degree of truth to them. So we're all laughing about this issue and making light of it, but ultimately we're continually contributing to the problem, not only systemically but internally systemically, for having a fear attached to something that's actually probably something you need to pay attention to. If you're having a hypochondriac like response to something, or a germaphobe, is that you're now, it's a combination of actually having a very, very good like perspective, strong perspective, but it's now attached itself to an urgent, active, like inflammatory response. And that slowly but surely, it may not kill you today, but it is slowly and slowly going to warp and take away from your mental, cognitive, physical, all the types of different energy that you can identify in your life, and ultimately create part of the problem, because it's going to create avoidance. It's going to cause you to turn a blind eye when you have a wound that's not healing. That's another one that I see a lot of people. I just recently had a client come back who has chronic skin conditions, and they had improved having been consistent with mental health therapy, with going to a nutritionist, with going and using the resources. It was a lot of work, and I give that to them, but they saw progress. They saw their skin inflammatory response. Your skin, if you're having skin issues, that right there is not just, oh, let me put some Neosporin on it and keep it moving. Now, I understand there's a lot of, here's another, my next point is there are a lot of situations where we know a lot of information about how and who we are, what our patterns are. And that's a really great start, because me as a clinician, I can't do my job to help you unless I don't know patterns. And so I operate off of like a database of generalization patterns when it comes to human behavior and emotional responses, but I don't know each person's individual pattern. So once they start paying attention to theirs, that helps me be able to formulate an understanding of like what's going on, and maybe making some small initial changes that could easily clear up a whole lot of issues. But when you go to a provider and you've been so stuck in a rumination that's triggered by fear or triggered by shame, that you literally, your brain cannot take in more information about yourself or collect more information about yourself, or not distinguish between having too much information about yourself, where you start to reinforce and self-sabotage in your own pattern. And what that typically looks like most with white coat syndrome is Googling. As much as there are a lot of good resources and a lot of good information out there, but with most of my clients and I have to have a conversation about is making sure that they don't continuously try to solve their own problem. Because one is that you're already in a natural bias because you have an emotion that is happening internally that is making you think that, one, you're a problem and you got a problem. You're not a problem. Is there something problematic happening? Abso-freaking-lutely, and probably that's what needs to be addressed. But you are now potentially risking making it worse by trying to research your own problem. And now I'm not saying don't do that, but I'm going to encourage people for you to consider the timing of which you do that. Because there are plenty of providers out here that are burnout, that are more book smart than they are people smart, and they're not investigative. They go based off of that database of like, oh yeah, I know what this is, da, da, da. And they miss particular questions and considerations to what symptoms are actually coming about. But if you have reinforced a chronic distrust of physicians because you've had exposure to one, a couple, maybe even a lot of physicians or doctors or medical providers or healthcare providers in general that have reinforced that potential fear, you now are actually becoming more of a contributing factor. Excuse me. You're becoming more of a contributing factor to your ailment than you are to your recovery. And it is a natural experience. It's one that from the outside looking in, you'd think was like, oh, I look pretty stupid. No, you looked fairly normal. You probably looked like you were upset and dealing with something, but it's such a common issue that in healthcare, we're so versed with how to just have to like work with people who are fearful of us that you got to trust somewhat of the process so we can get something new of a perspective going and figure out how it is that we can get you connected to whether it's another specialist or a provider or just the information you need to be able to make changes at home. So that is another thing about white coat syndrome is that how do you identify, like, do I have white coat syndrome? I'm just going to go ahead and tell you to assume that you do. Because at this point, I've not met anyone who, they usually come to me and they're like, I have this issue. It's just a mental health issue. And part of the reason they don't even consider it to be any other issue of like one that is a hormone imbalance or a physical issue is because most people have the same common seed of having a really crappy experience with healthcare providers, or their parents have had crappy experiences, and that information has become biased to their experience and ultimately plays out in avoidance of them going to get an insight to what's going on internally and ultimately being able to do anything and make changes that actually will help them accomplish what it is that they want in life. Okay, so that is if you're doing a lot of your own research, just make sure that you're considering how you give yourself perspective to that research. And I'm going to highly encourage you to be with a physician, someone who is trained that way, your doctor. If you don't have health insurance, this is like, to be honest with you, there's still no excuse. There are health departments around the world that you can go around the world, but then also this country that you can go. And I understand that is a whole stigma in itself. But if you're doing some of your research on that back end and going to share it with someone who can give you and either confirm that that's what is going on, or they can help put you in a new direction of something that you didn't even consider, and a test or something like that, There are resources out there. There are resources to do that. And then hopefully this is going to be a resource for someone to be able to get to that point. Because, you know, when I'm dealing with addiction recovery, I have to go through like all the different facets of life to see where people are in terms of their education and their understanding of how to take care of themselves. And a lot of people have deficits in just this one area. You know, I do support using medication to help overcome that fear response, because now I'm going to get into like, okay, well, what do you do about it? You know, you got some reaction to having like in conditioned response to white coat syndrome. So what do you do about it? The first thing, and my tip is always, always, always take an intentional breath. 3 inhale, hold for 4, exhale for 5. I cut that one a little bit short for the purpose of being on camera, but the hold is going to help get your central nervous system to pay attention. It's like, I hate to snap at people, but this is how I get my own attention. I'm like, oh, got it. And I reinforce that change with a sound. And that hold is taking your respiratory system and being like, give me back control, and taking your brain and be like, pay attention, and aligning them. That was really aligned in terms of my cameras. I apologize. So this is that hold in itself. You do that. I tell people do that for 3 times. Inhale for 3, hold for 4, exhale for 5. Do that 3 times. Take a short break. If nothing's changed, it's only 3 breaths compared to the multiple that you were taking probably too fast or not enough prior to. So take a quick break, 3 to 5 seconds, breathe normally, and then do it again, and take a break, do it 3 more times. So 9 total, and then see whether or not you're still thinking the same way about your annual physical and making that appointment. So the first and foremost thing is going to be intentional breathing. So that's tip number 1. I want you guys to recognize that avoidance is not just about avoiding making the appointment, and it starts long before you actually get to the reality of your fear. And so making the appointment is where avoidance is actually keeping you. This is pretty much procrastination, and why I encourage everyone to consider that, yes, under a certain degree of stress, everyone's going to have an attention deficit disorder, but it is not a chronic, well, it can be a chronic issue, but it is, if you are under a certain amount of stress, your brain consolidates its functioning to be able to be more efficient. And then it just produces really bad habits in itself. It's trying to protect you and being able to, because like, oh, this is stressful. When back in the caveman years, it did that when we were staring face to face with something that was about to eat us. We don't really have as much of that anymore. We do have very high stress situations where life or death experiences are happening, but we have now malfunctioned in a certain way because of lack of information, because of maltreatment, because of trauma, because of all these different things, right? That it comes down to the individual being able to regulate in order for you to get different results and be able to literally see differently. Visually, like colors will change. The more that I regulated, so sorry, back to me, quick story. You know my story, used to be close to 400 pounds. I'm a tall girl. I reinforced that identity and that belief. That's a conversation for next week. We're going to be talking a little bit more about identity and the trickiness of it, right? Is that accepting ourselves can also become a bias, because we're accepting the things, the good and the bad, which do need to be happen. But in order for us to move forward, we have to deconstruct some of our belief systems about our identity and whether or not they actually serve us. So when I talk with people, or excuse me, I was on my story, about I don't know why I want to keep saying 4 years. It's been almost 6 years now that I've been started on this journey. I was working in this profession of social work, dealing with people who literally was like, you can't help me. You've never been addicted to drugs. And I was like, no, you're right. I've never been addicted to drugs. Excuse me. However, I have been addicted to food. And the more that I kept learning, the more that I kept taking information, the more challenging it became for me to do anything about it. I was helping other people so much to the point where I did not understand where my brain was unable to function. Attention deficit disorder. I was diagnosed with depression and anxiety from a very early age. And had physical consequences early on in life. And one of the biggest ones being that I just expanded. I continued to eat because that was what made me feel better, right? And then since we're talking about white coat syndrome, every time my mom took me to the doctor, like a good parent that would do that. So there's a whole other reason as you may have a white coat syndrome aversion is because your parents never exposed you to health from an early age. But point being is that I started to get this, like, you don't fit into the numbers. You don't fit into this. I was a big kid, visibly. We could really see that. But we had no idea as to it was just being a couple of things. It was how frequent I was eating because I was hiding a lot of it. Because at that point, I wasn't able to understand and interpret my mother's anxiety about me being the unhealthy child because she was so burnt out dealing with a hyperactive my older brother. And I just kind of like slunk to the back, and then I would walk behind her and go grab some cookies, and I'd be a happy little camper. You know, don't have any issues from little Sara because I was solving my own problem. I was going and I was like, oh, you know what would be really good right now? Cookie, because this is stressing me out. I wasn't thinking this as a child, but this is my interpretation of like, cool. So I was working in this field, flash forward to like after, got all my education, got a master's degree. Y'all think I'm like super smart, but a lot of it is because I had to take a real hard look at myself. And it's not because I learned this in school, it's because I applied what I did learn in school and in trainings and honestly just by failure of the multiple failed attempts to go on a diet. I can't tell you how many gym memberships I never actually showed up for. And talking about it so much to the point where it was just like, well, what's the point anymore? It's not working. And then I finally realized, and I got to this point where like, well, it's because no one ever really knew how to make it make sense to me. No one simplified it to the point where that my overstimulated brain could really grasp and retain that information, because then I would leave the conversation and then go right back to the substance that we all have some form of addiction or a tolerance to, which is sugar. Now, I'm not going to demonize sugar because I love it. I just have a more healthy relationship. And what that means is that it makes a presence in my life. This would be my Dunkin', my coffee cup. Okay. I have 3 pumps of butter pecan syrup in this coffee. Okay. It makes its presence in my life still. The thing is that I just know where it stands. And I've had it literally a conversation with the concept of, with myself about how I'm going to interact with sugar on a day-to-day basis. And because the reason that happens is that sugar has the same brain reaction as cocaine. So this conversation becomes this is why a lot of people, I don't think, get to understanding themselves, is because it's such a broad intersectional discussion, and there's so many different, it's like, oh, get off of this exit, right? And it has taken me 5 to 6 years of intentional mental training and accountability of just, that was with my journaling, that was with going to therapy myself again, and but in this round, considering it an addiction versus considering it something that I just have to do. I took it more seriously, and I ramped up, and I was like, you know what, this is a risk, because I don't know, I don't want to call myself an addict. I don't do drugs. That's just for the drug and alcohol users. I'm not an alcoholic, and I don't drink, but I'm like, but maybe, let me just consider if I had what we understand addiction to be as a series of behaviors that on a substance or a process that is a part of your life that has a certain amount of consequences, positive or negative, but mostly negative, that affect your family structure, that affect your ability to engage in your life. That's an addiction. It's not necessarily just with a substance, right? So it's like, oh, well, in that case, maybe I am. Maybe I am. So then in addressing that, was I able to like, oh, this is becoming something that makes me so nervous, so fearful of what someone's going to tell me and what I'm going to be exposed to, that makes me go back to sugar. That makes me go back and binge eat because my brain was like, you're under so many stress, we just shut down. And I go into mindless mode because I didn't have enough energy to stop myself after a long day of working with clients, being overexposed to other people's energy. Okay. So this is just the intricacy to tell you guys, is that like white coat syndrome in itself. I wanted to just talk about that, but how it manifests, what it looks like in your day-to-day life is literally just if you cannot find yourself prioritizing making an appointment for yourself. I had 2 cats that got better health care than I did. Okay, and one of them, who unfortunately has recently passed, got better health care, better dental care than me, because it was easier for me to pay attention to his issues, let alone see the influence of my issues on him, than to actually pay attention to my own. So another way it manifests for me too, so I am very fair-skinned. You know, I have misused is not the word I want to use. I have abused my skin throughout the multiple sunburns, like 2nd, 3rd degree sunburns sometimes, because I just hate to put on sunscreen. I never liked it. That I have a lot of, beauty marks. There's a good reframe. I have a lot of moles. I have a lot of freckles. And because I don't have a lot of melanin in my skin. Guess what, newsflash? I am Caucasian. I'm like white, like to the point where I have a redness to my skin. Come to find out, that was a lot more hormone imbalance than it was ever just the way that I was supposed to be. Okay. So I specifically would avoid going to the dermatologist, and still to this day a little bit too, is because there's so many. I don't know if y'all can see this, like this lighting is, anyways, point being, I have sensitive skin. There's a part of me that I'm like, oh, I want to go to the tanning bed because I need a glow, like especially this year, because I am like white, very fair skinned. And like, oh, it will make me look better. But then I really have to consider, do I want to speed up the process of aging, of my cellular ability to, like, do I want to speed that up given that I've worked so hard to slow it down? And in that case, no, I don't go to tanning beds. Will I get a spray tan from time to time? Yeah, it just hasn't been that important to me right now. Cool. So let me get back on track here. White coat syndrome looks different for everyone, but what are those things where you find yourself, making an excuse where it's like, oh, I'll make that appointment, I'll do it. Because the point is that it's not just a matter of avoiding the appointment. It's avoiding the steps that even get you to considering why that appointment is important. And that is really kind of some of the underlying reasons as to what white coat syndrome and how it presents. So jumping over and finishing some of the tips. What if you're seeing this, what do you do? That number 1 was, please do that intentional box breathing. I will put the link in this this description of this video, so you guys can look at the visual, the YouTube video of like to help you regulate that breathing. Because what that's going to do is going to slow down your central nervous system and allow your brain's ability to kind of come back online. Just like when the Wi-Fi falters because the electricity falters, the whole Wi-Fi system goes down. It's what happens to your brain and your cognitive ability when you have a stress response that you're not paying attention to. You literally can't finish the thought. That's what attention deficit disorder is notorious for. So really one of my main things is I help people regulate and then also go through stuff as to why they become dysregulated. So breathing is the first one. Hydrating is the second one. So every time that you find yourself like, oh, I got to make that appointment, take a sip of water. Because more than likely dehydration, or if you drink a lot of water, make sure you're supplementing a little bit more with electrolytes, because that actually has nutrients that sometimes drinking too much water will dilute the nutrients that your brain needs to stay in a sharper, active state. So here's my last tip, that if those 2 are just to get you to being able to overcome the steps to, finding a PCP, that's the other thing, or dealing with insurance. because that's a whole world in itself. And if you ever have any questions about what certain things mean, co-pays, co-insurance, all that, I don't know all the answers, but I can help you. And I have some articles on my website and my blog that help break that down and understanding of like what your financial responsibility is going to be in going to the doctor and using your insurance, or if you need places that will help with free healthcare or reduced healthcare. Definitely have some resources there. So if you've made the appointment. Now, what do you do the day of? My number one thing is making sure that you budget your time appropriately so that you're not rushing. So this morning, I kind of did this. I technically took doing my hair. I was going to curl my hair today, and I took that off because I knew that I had this 8 a.m. appointment because I had fasting labs this morning, and I wasn't going to be able to eat. So therefore, I was going to be a little bit like, because when I get hungry, I speed up. My attitude speeds up and I physically speed up. And you'd be like, why? You don't have energy. It's literally, we are a theory of opposites as humans. We're all backwards. We just have to understand where we get stuck in the backwardsness, right? So giving yourself so this is where I want to make sure, because there's some people who already give themselves more than enough time. That in itself can be a little bit anxiety provoking. So making sure that you give yourself a reasonable amount of time. You overcompensating on time and being super early to things is actually sometimes contributing to whether it's the white coat syndrome or just the stress response, because at some point you're not trusting yourself to be able to be there and to get there without having a stress response that's going at the same time. So for me, I used to be that person. It's funny because now the pendulum swung to this side and I was 6 minutes late to this appointment. And part of my recovery is not only just prioritizing, making sure that I have my time budgeted, but making sure that I'm not over compensating the stress to be like, oh my gosh, I'm late. They're going to hate me and they're going to cancel my appointment. I literally got there. I had already completed my forms online too, so that helped save some time. But I got there it was like 8:07, I think. My appointment was 8 o'clock. And she was still, the woman was still in with another patient. And guess what? Instead of having to sit there and be like, oh man, I gotta go, and how long is this gonna take? I was actually able to just be like, all right, it worked out. I know not every situation, but just remember that if you are going to be late, you have options. They could possibly see someone before you, or you could tell them that you're on your way. I almost called and was like, I'm on my way, because I know on 440 there's this comes down to 2 lanes, and I'm like trying to get through and people aren't moving the way I want them to move. So I got stuck in a little bit of traffic, and therefore I wasn't excessive with my speed. So so when you budget your time, you have to be mindful of a couple of variables, not only giving yourself enough time, breathing while you're driving, but making sure that you're not actually reinforcing the stress response with the speed of how fast you drive. So I am notorious for doing this. And this is part of the reason why I consider this a vulnerable conversation, is because I'm going to admit that I was part of my own problem. The anxiety that people feel for me, it is because I'm moving too fast. My brain is naturally conditioned to move too fast and have inappropriate efficiency. This is what we need to call attention deficit disorder, is inappropriate efficiency disorder, is that you have tried to cut corners, and it helps a lot of ways to be efficient, but being too efficient creates the problem. So driving, grew up in the Northeast, tried to drive with Massachusetts drivers. It's a whole trauma in itself. And I was reinforcing my own elevated heart rate because it was like, gotta go. And I would get angry. My road rage comes back out. And, it keeps going and it snowballs from there. These are just little minute things that you train yourself. And this is what I did, actually train myself, my mindfulness, when I was driving. So when you're trying to deal with white coat syndrome, be very mindful of making sure that even if you are late, if you don't want to drive the speed limit, don't go excessively over the speed limit and try to rush getting there, because then you'll be confirmed with your blood pressure is so high. We're going to have to take that. Are you sure you're okay? And the concerned healthcare providers that are there to help you will now reinforce every embarrassing fear-based issue that you have when it comes to your health, whatever it is. And to this day, you're naturally going to have a higher blood pressure when you go into, if you've ever dealt with white coat syndrome. So just try to take a little bit of control back to your life. And by slowing your heart rate on the drive to there, that's my best recommendation I can come up with at this point, unless someone tells me that that's problematic in itself and I have to get more detailed. I've never had it. Most of the times I tell people to be mindful on their drive there. They don't have much of a problem once they get there. Doesn't mean that they won't take your blood pressure and it still be a little bit elevated. So my next tip is making sure that that intentional breathing comes and starts again in the waiting room. When you're sitting there, probably just looking at your phone, trying to distract yourself from the thoughts, just start getting in tune with your breathing there, because ultimately that's what's slowing your heart rate. That's what, and then just start, if you need a mantra, be like, I am present, I am healthy, and I am going to, I'm going to be okay. Because at that point, if anything happened to you, you're in the right place, okay? There are doctors there. If you literally end up giving yourself a heart attack from the stress that you're under, you're in the right place. So you're going to be okay. You're going to be okay. So when you can get there, so this is going to be why I put this as my last tip, is asking questions. You literally can't get to the point of asking questions, which a previous tip would be to write down your questions as you have them, because your brain under stress, and the likelihood is that you're going to reduce your stress to 0 is very unlikely even with all these tips, but you're going to reduce it significantly with doing those tips that I just talked about, is that your brain literally can't recall. It's just like, yo, woman, you've put me under enough today that your consequence is that you're just not going to remember the questions that you have. So here are some of the questions to ask, especially when it comes to getting your annual physical, is asking whether or not there is a vitamin D level. Now, most physicals, you can get them at any point during the year, but more than likely they're going to be conditioning you to be beginning of the year. Get your insights, get this, right? And what I learned today is that a typical health insurance approved annual physical does not include blood work that gets vitamin D levels. It is January. We're smack dab in the middle of winter. The sunlight is less and vitamin D levels are on the low. So I am not a physician. I'm not a doctor, so I can't give you medical advice, but I can suggest highly as a mental health clinician that you can probably benefit from a vitamin D supplement. And if you really want to make sure that you could, and if your mood is off, if you're irritable, if you don't feel motivated, go ask your doctor about your vitamin D levels, and I can guarantee you they're probably like low. And that was actually, so I learned that today. I just happened to think about it sitting there when she was looking for my big old vein that had already collapsed at this point, but you guys are going to hear that story. I'm not going to repeat it again. So, the vitamin D levels was not part of my annual physical, and I requested it, and I'm probably going to end up having to pay out of pocket for it. But considering that my focus has been a little shaky, my motivation's been a little shaky, I do literally just in the process, but then also trying to clean up, having moved this last month. I can make sense of it, but I told myself when I made this appointment, I'm not going to let my solution be the only solution here. I still have to go get my labs drawn. I know why I'm tired. Okay? We all can figure that out. We know why we're tired. But that does not negate the reality that you may have a chemical imbalance going on internally that has quite an easy fix. Taking a vitamin D supplement. A lot of people are just naturally low on magnesium too. So if you're having sleep issues, consult with a provider, another provider, not the internal provider that you have, about magnesium for sleep and figuring out what would be the best for you. But asking those questions is my last tip, and preparing those questions prior to. You can Google that. What questions to ask your provider for an annual checkup? that's a safe Google experience. If you don't know what questions to ask, now I had a great phlebotomist that actually told me what I was getting in my labs, which I think that's probably what prompted the question, was to ask about vitamin D, but it wasn't something I had planned on before. And then I was like, oh, look at that. Isn't that ironic that I just happened to be talking about white coat syndrome today on my live? So that's pretty much, yeah, what I would like, what an outline for white coat syndrome really is. Consider how it affects your life. Who does it affect? Stay focused on yourselves. You probably have a bunch of family members who pisses you off that they don't go take care of themselves, but the best way to create change is to do it yourself. And then, yeah, the 3 tips of stay hydrated, breathe, and write your questions down, because those are probably the most neurologically possible things to understand as being a patient in addressing your health. So I look forward to any feedback that you guys have, your experiences with how white coat syndrome has come to be for you. And I call you guys to action just to challenge it, little by little each time, because you're not going to get anywhere with just allowing your brain to default back to like, no, it's not important. I'm not important. You are very important. We need you here. The human species literally thrives when we have more of each other. And then you'll learn to be able to overcome those internal barriers and be able to prioritize yourself, your mental health, your physical health, and regardless of what degree of chronic illness that you deal with, and change your life and align with transformation each little bit every single day. So I will see you guys next week. We are talking about identity and how it influences mental health and mental illness. So yeah, I'll see you next week. Have a good Friday. I am off this weekend. I'm going to try to unpack a little bit more and get settled so I don't literally talk this fast, hopefully every single week. So I will see you guys next week, and have a good weekend.